Hi, my name is Kristen Ritchie. I am a certified foot care nurse, and today's presentation is about foot care to improve foot health. The plan that I'm proposing is based on a few studies. The main study, which proposes this plan, had results that decreased risk of falls and improved dynamic balance, which is balance while walking. And their plan was to strengthen muscles, increase flexibility, perform foot hygiene, safe nail clipping, to examine feet for any skin integrity issues such as wounds or pressure points, and to evaluate whether you're wearing the right shoes. The study based on this plan included 11 women who performed their own foot care over a 6-month period, and significant findings included increased pressure on the bottoms of their feet where you're supposed to have pressure, including the big toe, which gives more leverage for pushing off and a more stable gait. They also saw an increase in arch and arch support, and they also found significant findings in a decrease in falls. In the group of 11 who performed foot care, they had no falls over the 6 months, whereas in the control group who did not perform foot care, 4 out of 10 of the women had a fall. This video will go over briefly the science behind the plan and the exercises as well. Foot movement is determined by several factors, and if you have reduced foot movement, people are at risk of falling. So we want to focus on things that will help increase our foot movement. If this plan is performed an average of 5 days a week, it has shown significant findings in decreasing falls, as well as non-significant improvement or maintenance in foot movement, which can also help reduce risk of falls. The types of foot arches, we have normal, a flat foot, which can be either flexible or rigid. If it's flexible, it's typically weak arch support from a deconditioned foot. And then there's high arch, which is more structural, and we won't be focusing on high arch. We also see here in the bottom picture the 3 main points of contact, which is the heel, the ball of the foot at the small toe, and the ball of the foot at the big toe. Your longitudinal arch is supported by fascia and ligaments as well as muscles, so it's the muscles that we're going to be focusing on to recondition. To give an idea of the types of foot positions, you can have normal overpronation or underpronation. Typically when people have flat feet, they have an overpronation in a foot position. And so for normal, you have the heel strike, you have what's called the transition, when your foot is rolling forward, and that's when your midfoot gets contact with the ground. And then you have the toe off, and that's really where we want to have the big toe getting all that pressure on the bottom of the big toe. If you have overpronation, you're rolling towards the inside of your foot, and your push-off is going to be the inside of your big toe. So we don't want that. And when it's underpronation, you're rolling off from the outside of your foot, and you're really not getting much first toe pressure with underpronation or supination. Here's an example of the pressure that we want on the top picture. The purple is the most pressure. So we see the heel has the most pressure. Around that ball of the foot, the first metatarsal head has the most pressure, as well as some pressure around the small toe. Here we see the pressure distribution that we want. We want most of the pressure to hit our heel, the ball of our foot, and the bottom of our big toe. If you look at the 2 big toes, one has a purple circle, one has a yellow circle. The yellow isn't getting very much pressure, and that can end up with pincer nails and be off balance. Here's another example of the pressure mapping. You can see the height of the purple is how much pressure there is. And so you see that pressure in the first toe. So when you're pushing off, focus on pushing off the bottom of your first toe. Because as this slide shows, when you push off the bottom of your first toe, your nail's natural curvature force is balanced out by the upward mechanical force, or by that pressure going up against it. Both of these people are active walkers. The difference between the left and the right is the one who has normal pressure on his big toe does not have a problem with nail curvature, whereas the one on the right doesn't have pressure on the big toe and does have what's turning into a pincer nail. Here we see just the bones of the foot and how they create the arch. And on the bottom, you can see that green line. That's the ligament on the bottom of your foot. And the muscles can support that to form an arch. But the important thing of why we want to be working on these muscles and strengthening these muscles is when you have that toe off and you're pushing off, your foot forms a lever. So you need that rigid structure to have that stable push off. So just quickly, there are a lot of muscles in the foot, and the 4 exercises that are proposed have been shown to activate every single one of these intrinsic muscles that we want to focus on. And some of the exercises target certain muscles more than others. So it's good to have a variety of these exercises. But you have muscles that curl your toes, muscles that spread your toes, and then you have muscles that lift your toes. So we're looking at the intrinsic muscles. There are also extrinsic muscles, and those are basically your ankle muscles. So inversion, turning your foot in, eversion, turning your foot out, flexing and pointing. But we're focusing on the fine motor skills of your feet. So again, here's the plan. First, we're going to go over strengthening the muscles with the different exercises. Short foot, toe spread out, first toe extension, and second to fifth toe extension. The first toe is the big toe, and then the fifth toe is the little toe. So it goes along the line in 1, 2, 3, 4, 5. So our goal is to increase arch support and increase the push-off pressure from that big toe. The first exercise is the short foot exercise. And at first, this is going to be really minuscule movements. It takes a while for your mind to connect with your muscles to know which ones you should be moving in your foot. But eventually, you will have more of a connection and be able to visibly see your arch rise. For this exercise, you can start off with sitting. If it gets easy with sitting, you can move to standing on 2 feet, and if that's really easy, then you can stand such that more pressure is on the foot that you're working on, but always holding on to an object to make sure that you're stable. First, you want to re-establish placement for your foot. So you want to lift your toes and then gently drop them down. And the goal of this is to keep your toes inactive and just focus on the ball of your foot moving towards the heel of your foot. And you can also imagine that arch lifting up. Those are the muscles that help support the arch. Another study showed that when you perform this short foot exercise, if you hold it for 10 seconds, rest for 1 to 2 seconds, and repeat that 5 times, and do it several times per day, you can have improvement in 2 to 6 weeks. They saw improvement from poor arch support to good arch support within that time. And of course, the condition of your foot is going to play into how long it's going to take. When you're doing the exercise, try to focus on which muscles you want to be activating. The next exercise is the toe spread out exercise. So for this one, you're going to want to lift and spread all your toes and then place down your big toe and your little toe down on the ground, and then really focus on having those spread out as far as possible. This can end up feeling frustrating because your toes may not do what you want them to, but like all muscles, it just takes some time, and they will be able to perform those movements bit by bit more and more. So you have the big toe and the little toe on the ground, then you can relax those middle toes and hold for 10 seconds, rest for 1 to 2, and repeat 5 times. The next exercise is the first toe extension exercise, where you're going to lift your big toe and leave the other toes on the floor. And we're going to do the same as the previous exercise. Hold for 10 seconds, rest for 1 to 2, and repeat 5 times. And do that at least once a day. So you really want to focus on lifting and spreading at the same time. And the last exercise is the second to fifth toe extension exercise, where you're going to lift those toes 2, 3, 4, and 5, and leave the first one on the floor. And again, holding for 10 seconds, resting for 1 to 2, and repeating 5 times, and performing it at least once a day. So those were the exercises. Now we can move on to increasing flexibility. For stretching out your toes, this is going to be a passive toe spread, where in the exercise you did like an active toe spread. For the passive toe spread, you want to stretch out your toes, put your big toe on the ground first and kind of lay them out and stretch them out, and lay your little toe down and really use the friction of the floor to passively stretch your toes. And for all of these, you can hold for 15 to 30 seconds. We want to stretch the tops of our feet and our shins. So while sitting, point your toes and place the top of your foot on a padded surface on the floor and slowly stretch the top of your foot. And remember, if any of this hurts or feels uncomfortable, please stop doing that stretch or that exercise. And the third stretch is going to be stretching the bottom of our foot and our calf. And so this is basically just a calf stretch with focus on the bottom of the foot. Put the ball of your foot up on a wall and lean in towards the wall until you feel a slight stretch, and hold that for 15 to 30 seconds. Additionally, massage can stretch out those muscles, so you can do this while you are applying lotion, and focus on the heel, the sole of your foot, and your toes, and think about those muscles that we just went over. You want to massage in the direction of the muscle. Next up, we want to think about performing good foot hygiene. It's best to avoid soaking your feet because it can cause skin maceration, which is basically soggy skin, and that can lead to skin breakdown and infection. So the pH of our skin is actually slightly acidic. We want to match that with a mildly acidic soap to keep that pH of our skin. Otherwise, our skin ends up getting dry and cracked and have some issues. It's good to use a washcloth to exfoliate dead skin. Fungus loves to eat dead skin. Dead skin is made out of keratin, and a lot of fungus eats keratin. So if you get rid of any dead skin, that's going to decrease the amount of maceration you might get, because that can maintain moisture and help keep your feet fungus free. And then you really want to thoroughly rinse and dry, especially between your toes. It's important to keep your feet dry. For the lotion, that should also be mildly acidic. And we want to avoid putting lotion between our toes because that can increase risk of maceration. So remove any lotion that does get between your toes. And the brands that you can look for that are mildly acidic, some examples are Aveeno, CeraVe, Cetaphil, and Eucerin. We want to perform safe nail clipping techniques. So we want to clip from corner to corner following that free edge, and really just clipping the front of the nail. You don't want to clip too much of the side of the nail. The side of the nail isn't supposed to have a free edge. It's just supposed to be a nail groove. But when you're clipping, make sure you get all the way to the corner, because if you don't and it ends up just getting part of the way across the nail, you end up with what's called devil horns. And those are the spikes that can grow into your skin and cause an ingrown nail and infection. You also want to protect the hyponychium and the cuticles. The hyponychium is the skin right underneath the nail. So the hyponychium and the cuticle, or the eponychium, those act as a seal between the nail bed and the nail plate, and they keep fungus out and other infection out. If you don't feel that you're safe to clip your nails, then you can always consider filing them instead of using sharp clippers, or you can find professional help. The next item on the plan is examining our feet for skin integrity issues, and this can be something that you do while you're doing lotion massage. You want to look in between the toes for any skin maceration. You want to look on the fronts of your toes, because that's where your toes might be bumping the fronts of your shoes, and you could have calluses. Those calluses could also become pressure points and turn into ulcers. You want to look at your toe joints, for example, on the tops of your toes. If you have hammer toes, mallet toes, claw toes, those areas are going to be rubbing the tops of your shoes, and those areas can break down and end up becoming an open wound. You want to look at the soles of your feet, especially if you don't have much sensation or protective sensation on the bottoms of your feet, to make sure that if you have any corns or calluses that are causing pressure points, or if you stepped on anything and just can't feel it. And basically you want to look wherever your shoes might rub on your feet, because that's where you're going to have those friction injuries. Whereas if you have sensation, then just use your own judgment. It's also important to check the insides of your shoes. If you don't have sensation and say there's a rock in your shoe, you could be walking on a rock all day long, and that could end up causing an injury. injury. And lastly, we want to evaluate whether our shoes are right for our feet. The things that we want to look for are shoes that are breathable. Having a closed toe will help avoid injuries such as stubbing our toes or dropping something on them. Making sure that the heel is secure and not flopping around so that we're not walking around in a loose shoe. And you also want to make sure that you have minimal heel elevation. It's better to wear flats than heels. When you do have heel elevation, it is cramming your foot into the front of your shoe, and it's also throwing off your balance. The most important thing to look for is proper length and width. And there are two things that you can do on your own at home. You can do what's called the sock liner test or the insole test, where you take that insole out and step on it on a weight-bearing foot. And if your foot overflows the insole, then you're either going to need a wider shoe or a longer shoe, depending on where your foot is going over the insole. Another way is if the insole doesn't come out, you can make a line tracing of your weight-bearing foot and compare it to your shoe. So if you put your shoe on top of that line tracing, if you see any of that line, your shoes are not the proper size, width, or shape for your foot. And it's important that when you do buy shoes, buy them at the end of the day. That's when your feet are the largest, and you'll have the most accurate sizing. It's good to have a few pairs of shoes to rotate them so they can dry out so that you decrease your risk of fungal infections, and also wearing fresh, breathable socks or hosiery every day to reduce risk of infection. So in conclusion, this presentation described some of the rationale behind a plan that has been proven to decrease the risk of falls and improve walking balance. And we went over the 4 exercises that have been proven to activate those muscles that we need to make sure we have arch support and adequate pressure when we push off our big toe. So this concludes the presentation. Down below in the video there is a link to the presentation evaluation as well as a printable handout for the plan and the exercises. And if you would like to review these slides on your own, there will also be a link to the slides in the description as well. Please feel free to contact me with any questions or comments, and thank you for watching.